ladies and gentlemen. Thank you very much for coming and listening to my session. I'd like also to thank the Telemedicine Society of India for having me here today and having Polycom being represented together with our partners. My role at Polycom is to look after the public sector globally. And I'm not a clinician, but what I would like to do during my presentation is to share with you some of the elements, successful elements that I've seen around the world on how telemedicine programs have been successful. And the way they've been successful, I think, it's about collaboration. And there are two folds to collaboration. One is the real-time collaboration, where you exchange voice, video, and patient images in real time. But it's also the collaboration among partners within an ecosystem, where you have vendors, healthcare providers, governments, as well as medical peripherals and other players in industry getting together. And with the theme of this conference being about going beyond the pilot phase, I think it's time we talk about collaboration, that we move from the connectivity towards a more collaborative healthcare. I'll quickly start my presentation covering some of the technology trends, but not to be worried, my presentation won't be about technology per se. Then I'll go and drill into some of the business models. What are the pieces of the puzzles, once you put them together, that really can make a difference. And of course, I'll close very quickly with some case studies from the United Kingdom in particular. So technology is transforming healthcare. It's transforming healthcare in India, and you have heard it for the past 2 days in different areas. Digital health records, the fact that hospitals want to be more patient-centric and provide patient-centric care. We have initiatives around mobile health, as well as telemedicine, and I'm sure that some of you have heard of cloud computing as the next big thing to deliver healthcare throughout the country. What I would like to highlight also is what will be the next technologies, the technologies that are picking up around the world. Some of them are mobile devices. And we know how mobile devices have transformed the way people communicate in India and access communications overall. But here I'm talking about different kind of mobile devices, including tablets. A second technology or trend is the consumption of video. And when I talk about the consumption of video, I'm not only talking about the amount of people and the amount of videos that are being accessed on demand nowadays through video streaming, but also anything related to real-time video conferencing, telepresence, and so on and so forth. All of this is even more important as younger generation, and pretty much every one of you for your personal life or professional life are using social networks to get connected. In the future, patients will use social networks to connect with the hospital, to connect with their friend, and so on and so forth. And as you can do today, chat using social networks, you can do voice communication very quickly, video communication, real-time communication will be supported by social network platform. So you could imagine patient through a Facebook interface, a LinkedIn interface, being connected to the hospital in real time over video. It may take some time, but we are getting there slowly. Let me talk about collaborative healthcare. Around the world, there are many great initiatives around telemedicine. But many of you have mentioned that very often it's no longer about the network. My key point here would be it's about scale. How can you scale, how can we reach this scalability to make telemedicine and the delivery of care affordable? And some of the successful countries in that area, what they have been able to do is to collaborate with different entities and partners. They are connecting with district hospitals, rural clinics, but you also have nursing homes that are connected to the center of excellence. It goes all the way to home care, whereby patients can have a real-time interaction with the doctor using new types of business application phones, which also receive different vital signs via Bluetooth technology. We have countries that are looking at citizen service centers or community health centers. In some other countries, they are called local government units. Basically, a concept of a community center where all the people, villagers, can go to for all kinds of services, whether it be for civil and administrative services from an e-government perspective, whether you want to go for education, healthcare, trade, or even justice services. All of that can be enabled nowadays. And there are many initiatives in India whereby the statewide area networks are getting those citizen service centers connected. So in addition to e-government services, of course, you can provide healthcare and telemedicine services on top of that. But it goes all the way to prison, correction facilities, right? We have telemedicine providers around the world, especially in the US, that have made a specialty to provide medical care beyond the wall of a prison. Why? Because correctional facilities are very often located in rural areas. Getting specialists and doctors to those facilities is often of an issue, especially when you're talking about female inmates and the fact that many countries have a lack of female doctors able to enter the female block of a prison per se. And then we have other countries where the government and the Ministry of Health in those particular countries have initiatives where nurses will visit schools, right? And they will go and check for hand, foot, and mouth disease, for instance, and any kind of disease in primary and secondary schools with their laptop connected over the wireless network back to the center of excellence as required. Universities for education and research purposes. Some other healthcare providers, in fact, decided to target the private sector in specific industries such as mining, energy, and gas, where risks of accidents are extremely high. So you have people providing telemedicine all the way to oil rigs, to gas mines, and so on and so forth, in order to scale even more. We have even others partnering with the military and working together in times of natural disasters to do early triage, right? How do you dispatch and where do you dispatch some of the victims, some of the people that have been injured during a natural disaster or a man-made disaster? So all I'm trying to say here is until, let's say, there is so much more that can be done around telemedicine, and there are so many markets and segments where telemedicine makes sense that will definitely enable the access of care and at scale, reducing the cost of delivering all of that. We talk about software, hardware, interoperability, and we talk about different delivery models. The way the technology is going, it's moving away. It's moving away towards what is called a platform. A platform which, from the Polycom perspective, will provide real-time voice, video, and patient data in high definition, so that you can listen to the heart and lung sound of a patient in high definition using electronic stethoscopes. You can have high-definition camera and provide you the image of a skin or being connected to stethoscopes and so on and so forth. This platform needs to be scalable and interoperable and work with all kinds of medical application and medical devices as well. Now, of course, this equipment, you can own it. You can buy it and put it in your hospital. There is a cost to it. But nowadays, there are new delivery models for telepresence and real-time video, which are called hosted or managed services, we often talk about private cloud or public cloud. What's the difference? Well, a private cloud is where this platform is made available via a private network. So all members connected to that private networks have access to those resources. And a public one is pretty much open to everyone else. It's like offering this as a service over the internet. And to this platform, you should be able to connect any kind of endpoints, whether it be immersive telepresence room, standard video conferencing rooms, desktop units, phones, medical cards, as well as mobile devices. And whether they're from Polycom or not, it doesn't matter. It should work with any vendor in the marketplace. Because when you connect to district hospitals, rural hospitals, or with your partners overseas, you need to make sure that it's all interoperable. What are the specialties? Well, the key is to use that infrastructure and that platform not only for telemedicine, but for the entire administration of your hospital, for your distance learning and continuing medical education practices, and so on and so forth. Of course, all kind of, on the application side of telemedicine, all kind of specialties in primary care can be provided. I'll go quickly into an example, which is a telestroke network. This is the case in the UK, where you have nine health regions. It's the largest network in the UK. And the key was that after 5 p.m., there was no after service hours, right? So there's been a national initiative to improve outcomes, providing a 24-hour service access requirement. And when it comes to stroke, you probably know time is critical, and the key was to reduce the mortality. Unfortunately, in the UK, only 23% of stroke patients arrived within the 3 hours required to administrate the proper medicine. So telemedicine is used on a 24-hour basis, improving all of that. What is used? Different medical peripherals being connected to medical cards, and specialists having software on their computers being able to see the patients at any time of the day. Okay? I'll just give you an example on how is also video technology being used in operating theaters, and that is the case in the UK as well, where a consultant did a bypass surgery and taught other surgeons how to repair a valve in real time. Those other doctors, of course, being located all around the world. Last example is around, bringing telemedicine beyond the wall of the prisons, and that's an example in South Korea. And in that particular example, it's about female prisons in South Korea, where a lot of specialties are being provided, whether it be for mental health or any kind of diseases. All right? So I will just summarize my presentation by sharing with you that, to go beyond the pilot phase, you need the scale and you need a platform that will allow you to provide telemedicine pretty much everywhere, not just in the clinics and the hospitals, in the prisons, in the field. And it needs to be leveraged for everything, not just for telemedicine, but for the administration of the hospital, and shared, whether you want to own it, whether you want to get it as a service from a service provider, or in some cases, state governments build that infrastructure, and all healthcare providers can connect to that infrastructure and obtain the service from the government. And again, I will say, it's all about cooperation. This is why we have many partners here today, from vendors to healthcare providers, as well as the government and practitioners and clinicians. And this is where we want to be. We want to collaborate beyond the connectivity, beyond what we do today. Thank you very much for your attention.
Thank you, Mark. It's a very interesting talk. I would request Mark from the TSI and from the